Hello, this is Phoebe from Smart City Development Project Office. Welcome to 2022 Virtual Trade Mission supported by Industrial Development Bureau of the Ministry of Economic Affairs. And in today's topic tour, we will present you 3 companies that successfully deployed their solutions across 22 counties and cities around Taiwan. And first, we have AdvMeds with their healthcare system. And we're very honored to invite the Managing Director, Johnson Huang, to tell us more about the company and also demonstrate their solutions. Hi, Johnson, how are you? You may take the floor.
Yeah, sure. Hello guys, I'm Johnson and welcome to AdvMeds. So let me just introduce our team. AdvMeds is a health IT company and we support our partner in an efficient way to build up their smart health technology. So just for example, in this case, we have the Health Go Box. We do have the app. So just let me introduce about the Health Go Box. Actually, Health Go Box can link with more than 70 kind of devices. So that's what we talk about. We want to empower the user. They can easily collect their data belong to themselves. So just for example, we have the Health Go Box app can provide for the home visit service, and they can easily to use the card and use the blood pressure, and all the devices can collect and send it to the cloud. So maybe later I can show you a brief demonstration. And other thing is, once we collect the data and we send it to the cloud, and why we send it to the cloud is because we believe in the near future, the health data is one of most important massive data that we can analyze some valuable things from the people. Because I think health is a basic human need. So how we can equally and provide the user right to access their own data. So we provide the city cloud. So every citizen who living in the city, they can find any kind of related to the health promote or news or related to themselves for those information. So just for example, this is the app for the user, and actually you can find a lot of activity. Just for example, if you are going to quit smoking, and you can join to the program. It could be like a 3-week program, and we have the guideline, and we have the support team, we have the medical team can accompany with you. So far we have more than 50 kind of a program. You can find it in the app. So in this coming year, we are going to launch 5 cities in Taiwan, which is Kaohsiung, Taichung, Tainan, and Kinmen, and also Pingtung. So that's what we believe. Such kind of a city cloud is something we need to consider about in the near future if we are going to talk about smart city, how you take care of the people. So let me just go through this slide real quick. So actually you can see, based on this solution, we have not just the cloud, not just the app, but we also do have the smart equipment. Just for example, the Health Kiosk is kind of an all-in-one kiosk. We can collect so many different kind of vital signs. We can link more than 70 kind of devices, just like a blood pressure, glucose, SpO2, temperature, sort of things. So it's not just a kiosk, but also it can link with the hospital. In our project now in Taiwan, we already link with more than 80 different clinic or hospital between some different level. So the data could be shared to the hospital, but also they can receive more information from the healthcare provider. And just like I say, the Health Go Box, we can support for remote home visit, easily for mobile mHealth service. And everything could be sent to the cloud, so everyone can access to their data in the cloud, in the app. But also, we combine with some communicate tool. Just for example, in Taiwan, the population for using the line more than what I remember is 85 to 90%. So even the elder aging population, they can easily to use the line. So you don't necessarily to download the app to take care of yourself, but also you can use the line and to access your data. So cloud and line and app is all in the same platform. It's quite simply to let the people and also the facility or the city, if you are interested, just subscribe and choose what kind of module then you can use. Just like I say, we have more than 20 different kinds of modules. Just for example, if you are going to do the case management, you use that module. If you want to use the e-learning, you want to use questionnaire, if you want to use online teleconsultation, we have more than 20 kind of a module. You can define your own smart city cloud, how you're supposed to take care of your citizen. So in the case, we also use in COVID-19. Actually, we're doing quite well in COVID-19. Last year, we already implement to a few Southeast Asia countries, just like in Malaysia, Cambodia, Vietnam, and also Thailand. In this case, in Taiwan, while we are doing the COVID-19 prevention, usually we will ask the healthcare provider at the very beginning. We have to ask them to make in a phone call or make sure they test their blood pressure. If they do the test, ATK home test quite well. But now we can use such kind of AIoT devices. We collect the data automatically, and data will send it to the cloud, and we do the analysis and use AI service to give the feedback. So just like I say, once you are going to quarantine at the home, you are going to scan the QR code and join to the program. So you can define your own program, and based on the AI service, it can talk to you and give you the feedback. And so far, we already linked. In Thailand, we already serve more than 2,000 people in Phuket Island. But also, if you are feeling not well, you can also use teleconsultation to talk with for mental health needs provider. So far we have more than 370,000 users in this platform, and in Marshall Island, in some of the rural area country, and we can also find this case in the Africa country. So this is just like what I just mentioned. In Thailand, I think we do this case quite well. So we are interested, and we are looking forward to work with some other people, overseas partner. If you are interested for the telehealth, smart health, digital health technology, and I believe we do have something that we can provide to you. Yep. So I think health is a basic human need, so that's what we are doing. So maybe let me just allow me to just make a very quick demonstrate about the equipment. Yeah. All right. So here we do the demonstrate for the Health Go box. This is my assistant, and in Taiwan, even like in Thailand, they do use the ID card. In Taiwan, we do use the National Health Insurance card. So usually while you are doing the home visit, you will use the smartphone and we'll put the card in. Like this. So easily we can access your data in the cloud, but also we can do online, offline sync. So let me just do a very quick one, maybe like start from temperature, easy one, okay? You can, okay, maybe let me be the doctor. So for example, everything just wirelessly, all right? So the data could be easily to collect by the smartphone. I believe nowadays everyone have the smartphone. Let's just do a SpO2. So this is also the case, for the patient, especially for the COVID-19, the SpO2, sometimes it's quite dangerous. Well, oh, sorry, I forgot to push the button. Yeah, sometimes the SpO2 is the something we need to collect because it would be cause the sudden death. So they can easily, based on such kind of solution, and monitor it at home, and there will have a central monitor service can collect the data. Oh. Yeah. Yeah, I think because the SpO2 will take more time, but so it's okay. So everything just send like a send idea, wirelessly, portable, easy to collect the data. So I think this is the case that we want to show you how digital health can help us based on the technology to support our government in the smart city, how we take care for the citizen. So we are looking forward. If you are interested in our solution, please contact with us. So you can just Google AdvMeds, AdvMeds. My name is Johnson. Welcome to send me a message. Thank you very much.
Thank you, Johnson, for your demonstration. It was very clear. And as you know, we are in exhibition live right now. So you can see actually there is a lot of happening right now. But right now we're going to see a short video from AdvMeds. And here we go.
健康管理关系到您与家人的幸福。慢性病为全球死亡的第1名危险因子，约有1/2成人受到威胁。最好的防范就是培养定期量测的习惯。欢迎使用智慧健康量测站，这是一台以公共建设为基础的多功能健康生理量测平台。欢迎使用智慧健康量测站，请选择您要使用的功能。这项服务提供各种生理量测数据收集与健康讯息的传递，请选择您要量测的设备。友善化的设计，让您只需要花费几分钟的时间，就能帮您的健康把关。智慧健康量测站整合多种登入方式，智慧卡、健保卡、行动 APP 等，让您快速登入与云端储存。透过站台提供血压、血氧、体温、身高体重等生理量测收集，并与云端系统连结储存。这些持续累积的数据，将来都可以透过资料分析来回馈提醒您的身体状况。利用手机扫描 QR code， 即便没有安装 APP， 也能透过行动装置查看分析报告。您也可以把记录报告设定传讯给家人或是自己，家人可督促长辈健康管理并定期量测。当您就诊时，只要授权同意，量测资料便可供医师查看，让医师更充分了解您的身体状况。养成定期量测的习惯，除了可帮助您管理您的健康状况，量测结果也可以透过社群互动通知您的好友圈，分享与互相激励，建立您的专属互助圈哦。智慧健康量测站启动了新时代的智慧健康照护模式，打造以智慧健康城市为基础的公共服务。透过与个人健保、医院资料、个人行动 APP 的整合，每位用户都可以更方便得到适切的健康照护讯息，并与医疗业、零售业、药局等结合，发送您关注的产品讯息与卫生教育新知，达到精准照护、远距关怀的无限可能。
Hi, welcome back. And some of the viewers are curious, so we have a couple of questions for Johnson. And the first question is, what kind of partnership are you looking for right now internationally? And what is your partnership model overall?
Yeah, so far, mostly we focus on Southeast Asia country, and most of our partners are the engine or distributor. They mainly focus in selling the devices or equipment. If you are doing the business that's selling or delivers so for the medical equipment to the hospital, I think you are the one super suitable for bring the smart technology into the hospital. And we do have some other partner is like a telecom company. Just for example, in Taiwan, the 3 top one telephone company, they do healthcare business. So if you are looking for this kind of solution, I think we are suitable for you. And another question is, the partnership model. I think we will be the one to support the technology, and you will be the one to deliver the service. So just like we're doing quite well in Thai market, and before they just delivered equipment, but within our work partnership with us, they can evaluate their original service and top up into the market. Yeah, thank you.
Thank you. And we have another question. The last question is, because all these medical devices actually gather a lot of data from hospitals or to the consumers. So how do you comply the data protection in different countries?
Yeah, so I understand the medical data usually is more privacy in different countries and based on different law. So I would say we usually work with our partner is like if they do have the need, we can build a local cloud. Just for example, in Thailand, we use Thai cloud. In some of the hospitals, like in Cambodia, in Vietnam, they might host the service by themselves. So we do have the partner, especially for the server and system for those ISP company. Then we can also co-work with them. So we will based on your policy and law, and you will be the one to dealing with your government. We just support for the technology. Yeah. Thank you. Yeah.
Thank you, Johnson. That was very clear. Okay, now because of the time restriction, now we have to say goodbye to Johnson. But if you have more questions, please, you can leave a message in the chat room or contact us by email or contact AdvMeds Corporation directly. Thank you very much for watching. Hi, this is Phoebe. Welcome back to the topic tour. And the next we have Inventec Appliances Corporation, because healthcare is actually a big topic here in Taiwan, because we know Taiwan is actually getting towards to an elder society. So yeah, we need a lot of smart healthcare management system. So we have Inventec today to demonstrate and explain to us why their solutions is special and deployed successfully in Taiwan. And we have James today. Hello, James. How are you?
Hello. Good day, everyone.
Hi. So please take away. The time is yours.
Okay. Thank you, Vivi. Okay. It's my pleasure to have this chance to introduce to you for our product. And here I'm going to introduce. First of all, I need to introduce my company at first. Our company is Inventec, 100% owned company of Inventec Group. And currently, we made a lot of like smartwatch for Fitbit and other companies. But right now, we also focus on medical and healthcare devices. Currently, we have three fields we are targeting on. First is for Telecom field. We have Chiline HomeCare System. And second, in precision medicine, we have AdvMeds CTC detection system for detecting tumor cells. And third, in smart healthcare, we have SmartMed infusion pump. But today, I want to make my focus on the China healthcare system. And this is our China healthcare system. It is very tiny, very small, but in fact, it contains three of the measuring devices. And I will introduce a little bit later. First, I want to let you know our company, from design to hardware design to manufacturing and software design and the platform. The healthcare platform and the extension, all of above is made and developed by our company. So we can be your best partner to develop this kind of field. Okay, here's I want to introduce our devices. Hello. First, this is our blood pressure monitor. This is very tiny, very small, no screen, because we use cell phone app or tablet app to measure, to show all the data. And the good point is it uses a lithium battery, and you can measure in 5 times per charge. And what's the better? It can measure AVIP. And the second, this is our blood glucose, total cholesterol, and the uric acid monitoring system. In fact, it is very small, just like this. Using 3 kinds of test strips, you can measure all above 3 kinds of vital signs. And the last is our ECG monitor. Again, it is very tiny, very small. Although it is 1 lead ECG recorder, but it already can detect for AF and BBC. I want to use this some time to introduce a little bit further for our ECG recorder. For resting mode, we can have 8 kind of result from normal to detect our BPC and AdvMeds. And for ambulatory result, we can measure from 1 minute to as long as 24 minutes, 24 hours. It can detect arrhythmia for you. And all our data will go into the cloud. When the data go to cloud, you can have a better use of this. First, outside Telecom health agency can monitor your vital signs for you. They can ask why your blood pressure is higher and give you some suggestions. And what's more, here, the number 7. The data can be pushed to hospital server, to hospital information system. So when you go to hospital, the doctor can know the vital sign you measure at home. And this is our example of our Telecom health management platform. You can see a case management agency, a doctor. He can know all the case condition in a single screen. All the data like blood pressure monitor data, like glucose data, he can see here. Of course, he can enter this case to see the trend of this case. I think there's no better than use cases. We have a lot of proven cases in Taiwan. First, I want to introduce a very big hospital. Marquet always use our system in their Telecom health center. And the second is a hospital in Chiline Catholic Hospital. They also use our devices in mountain rural area to measure the data and send the data back to the hospital. Okay, right now I want to have a live show of how our devices work. Here I want to measure an ECG, record my ECG. So the devices will connect with tablet. So when I start to record, right now I'm recording a 30-second ECG. You can see it is real-time ECG from my own. And after 30 seconds measuring, the system will have an analysis result for you. Okay, the measurement is over, and the data already sent to already uploaded to the platform. Of course, you can check all your previous data in our system. This is what I just measured. And here, this is our health management platform. You can see when I have a refresh, and I put my case. You can see the ECG I just recorded already show on the platform. Of course, if this platform is connected to HIS system, this graph is already sent to hospital information system already. Okay, this is what we have right now, and in the future we will have optimization in our app and in our platform UI UX, and we will have new devices like pulse oximeter and three-way thermometer and Euroflowmeter within this year. Of course, we are applying CE and FDA rejection right now, so we will go to the world and find our partner in the world. Thank you.
Thank you very much, James. Now let's take a very quick break and watch a little short video.
Hello, ladies and gentlemen. Welcome to Inventec Appliances Corporation. I'm Austin Chung. Today, I'm really honored to introduce you our Chiline multifunction physiological measurement system. We have 3 medical devices to measure 5 vital signs. We have blood pressure monitors, blood glucose, total cholesterol, uric acid monitoring system, and ECG recorder. All of these 3 medical devices have obtained the following awards: 2020, Symbol of National Quality; 2021, Taiwan Excellent Award; and 2021 IF Product Design Award. And right now, let me show you more about our products. This is our Chiline multifunction physiological measurement system. This is our blood glucose, total cholesterol, uric acid monitoring system. It's able to monitor your 3 vital signs just by changing the test strips. This is our ECG recorder. You can use ambulatory mode to monitor your ECG for lasting at most 24 hours. Or you can use resting mode to monitor your ECG for a short period, like 30 or 60 seconds. The final one is our blood pressure monitor. It's very easy to turn on like this. And it's also able to detect atrial fibrillation. And right now, let's move on to our video.
Cardiovascular disease is an invisible killer, and hypertension is the #1 cause of it. Simply measuring blood pressure is not enough. Accurate measurements, comprehensive records, family care, and professional services are 4 of the most important aspects in monitoring and controlling blood pressure. Chiline Blood Pressure Monitor works seamlessly with the Chiline HomeCare app and perfectly integrates all 4 elements. The device is also able to detect arrhythmia, offering an added layer of protection. Hyperglycemia, hypertension, and hyperlipidemia are common risk factors of chronic diseases. Diabetes, hyperlipidemia, and gout have become common diseases of affluence. Aside from implementing diet control and making lifestyle changes, routinely measuring blood glucose, total cholesterol, and uric acid is critical in understanding whether progress has been made in risk factors control. Chiline Blood Glucose, Total Cholesterol, and Uric Acid Monitoring System is a portable medical-grade device that provides trustworthy results. One can measure all 3 indicators simply by switching to the corresponding test strips. The device offers comprehensive records of results and analysis, easing the process of health monitoring. Blood pressure records is not the sole predictor of heart problems. Chiline ECG Recorder provides a portable way to measure heart conditions 24/7. The device offers instant analysis for medical-grade ECG, so users can discover heart problems in advance. Chiline Multifunction Physiological Measurement System. Together with the app, highlights 5 product features, including 24/7 portable medical monitoring, comprehensive health and wellness records, stress-free family care, IoT healthcare services, and secure data with cloud storage. This system enables advancement from personal text recording to smart cloud management, offering healthcare management for both personal and familial needs. What used to be scattered information is now integrated into a comprehensive measurement system.
Hi, this is Phoebe. Welcome back to Topic Tour. Actually, we have a couple of questions that we want to ask James. The first question is, do you have any international use cases that's very successful? And also, what is the partnership model with this international partner?
Okay, thank you. First of all, currently we now have a lot of experience for doing business with foreign country. One, the first two is Thailand and South Africa. They buy a few sets of our measuring devices to their country and uses our platform to take a very early test uses of this. And the third one will be a Singapore company. They already decide to have their own server. Here, the Chiline server, they will have their own Singapore server there. So we help them build this server. So the data will go to their server and go to their hospital and any kind of business we can do. Because, as just I say, from hardware, from software, and to the platform, all of above is developed by our company. So we can have any change customer wants, and we can have customization according to customer expect. Thank you.
Oh, okay. So one last question. Do you have any experience working with telecom operators?
Yes.
Can you explain more?
Yes, we have already worked with Hong Kong Telecom Telecom service provider, and they are discussing on if they want to introduce our platform, and eventually they are still discussing because we just started the discussion a few months before, but we think we can get this done within this year. And in our estimation, the introducing of this kind of business model is quite fast because we can help them get their server within 3 months. And if they want to connect with some hospital in Hong Kong, in our experience in Taiwan, it can be done in 1 or 2 months. So it will be quite fast.
Well, thank you, James. That's very good to know because I think when the pandemic is over, everyone will be very looking forward to work with you. And we hope your cooperation will be successful and good luck with that.
Okay, thank you.
Thank you very much for watching. And please take a short break. We'll be back very soon. If you have any questions, please contact us in the chat room or just Google Inventec Appliances. Thank you very much.